As we age, our chance of developing an enlarged prostate rises. The majority of men over 50 are more likely to have benign prostatic hyperplasia, or BPH, which is characterized by an enlarged prostate. The prostate enlarges with age, although this increase is not malignant. Men with enlarged prostates may find it difficult to pee as a result of the prostate's tendency to pinch or strain the urethra. Other factors that contribute to an enlarged prostate include testosterone levels and modifications to the testicular cells, which may play a part in the gland's growth. According to certain research, men who are obese or have diabetes may have a higher risk of developing an enlarged prostate. We would strongly urge you to consult your healthcare physician for therapeutic choices based on your symptoms before we go into each advantage of these drinks. This video is meant to be informative. That being said, let's begin with item number 1. 1. Water. It is beneficial for your entire body to drink a lot of water. Thus, it is also beneficial to your prostate to drink a lot of water. Staying hydrated is essential for the well-being of all the organs in your body. Even while it's conventional advice to have 8 8-ounce glasses of water per day, it might not be enough. Greater amounts of water are needed by larger animals than by smaller ones. In order for your urine to be colorless, you need to consume enough water. Most of us think that urine ought to be yellow. Generally speaking, you are more likely to be properly hydrated if your urine is paler. Drinking more water will also require you to urinate more frequently. If you have an enlarged prostate, this could become an issue because it makes it harder to pass gas in the bladder. Certain underlying medical conditions, such heart or renal failure, necessitate a fluid intake restriction. Most men who experience the symptoms of an enlarged prostate cut back on their water consumption in an attempt to minimize the frequency of their urinal visits. This can seem like a sensible fix, but it might make your symptoms worse. Why, therefore, won't drinking less water help? Urine that builds up in your bladder becomes concentrated and might cause irritation when you drink less water. This sets off the urge to urinate, even if your bladder is not very full. There's not much in there, so if you do run to the bathroom, you might find that only a little, if any, urine comes out in a weak stream. Furthermore, concentrated pee creates an ideal habitat for the growth of bacteria, and some urine may stay in your bladder if you have a weak flow when you go to the bathroom. This can lead to a bladder infection, which is not what you want. Thus, is it better for you to drink more water? Yes, is the response. Your bladder can hold more urine at once if you drink more water because it will be able to create less concentrated urine, which will cause your bladder to age less. Urine is forced out of the bladder with more force when you urinate due to the increased volume, which increases the likelihood that the bladder will empty and produces a stronger urine stream. Therefore, a progressive increase in water consumption can be quite advantageous, as long as you do not raise it suddenly. Try to increase your water intake over a few weeks to about 2 liters a day. 2. Tomato juice. Lycopene, a substance found in tomatoes, has been investigated for its advantages in lowering the incidence of prostate cancer and hypertrophy. Tomatoes are red because of the pigment lycopene. It has a reputation for being an antioxidant and possibly an anti-inflammatory. We get about 80% of our lycopene from products made from tomatoes. Tomatoes also include a number of additional significant antioxidants that may shield our cells' DNA from the damaging effects of oxidative stress. The finest carriers for absorbing nutrients include spaghetti sauce, soup, and pizza toppings made with tomatoes. Certain research showed that complete tomato products provide greater protection to our cells than do pills containing only lycopene. Studies conducted by Harvard, Ohio State, and the University of Illinois on medical research discovered that a diet rich in tomato products lowered the risk of prostate cancer by 35 to 40%. In addition to being high in the necessary ingredient lycopene, tomatoes are also high in vitamins, minerals, and phytochemicals. According to a UK study, males who consume more than 10 servings of tomatoes per week lower their risk by 20%. Thus, consuming a cup of tomato juice daily offers sufficient nourishment to promote prostate expansion. 3. Matcha powdered tea. All tea, including matcha, is derived from the Camellia sinensis plant. Since matcha is produced from the whole leaf, it contains 3 times the caffeine content of conventional steeped tea. The caffeine in matcha is delivered gradually into the bloodstream, in contrast to coffee's rapid release. This is due to the fact that catechins in matcha and green tea bond to caffeine molecules. Caffeine enters the bloodstream slowly because it takes 6 to 8 hours for the catechins to break down. Let's now see how this miraculous drink made of powder can boost your general health and reduce an enlarged prostate. 1. High in antioxidants. Matcha green tea has one of the highest antioxidant ratings. Studies show that matcha tea has a high antioxidant content that can shield cells from harm caused by free radicals. Matcha green tea's antioxidants, especially its catechins like EGCG, may shield the prostate from oxidative stress. Oxidative stress plays a role in the onset and evolution of prostate issues. 2. Cancer prevention. Studies have demonstrated that the compound EGCG found in green tea kills prostate cancer cells, in addition to lung, breast, colon, and rectal cancers. 3. Calming effects. L-theanine, an amino acid found in matcha green tea, encourages relaxation and meditation. Matcha green tea has 5 times the amount of L-theanine, 20 milligrams versus 4 milligrams, than other green teas. L-theanine and caffeine from matcha green tea work together to prevent the jitters that come with coffee. Instead, you'll experience a calmer, more awake state. Matcha is best enjoyed in the morning after being combined with matcha overnight oats and refrigerated for the entire night. You are welcome to add additional toppings if you like. 4. Pomegranate juice. Numerous studies suggest that pomegranate juice may aid in the treatment and prevention of prostate cancer. Further studies in the laboratory and on humans indicate that it may be helpful in treating a number of additional illnesses. This juice has a lot of positive aspects. Pomegranates are rich in antioxidants, particularly polyphenols such as anthocyanins and ellagitannins. Oxidative stress is linked to prostate inflammation and cellular damage. Antioxidants counteract this stress. Because of its anti-inflammatory qualities, pomegranates may help lessen inflammation in the prostate and thereby relieve some of the symptoms related to enlarged prostates. Pomegranate juice has been shown to have anti-prostate specific antigen PSA effects. Prostate problems, such as BPH, may be indicated by a high PSA level. A good effect on prostate health may be indicated by a decrease in PSA values. Pomegranate chemicals have the potential to prevent aberrant cell proliferation and promote the general health of prostate cells by promoting cellular health. Consult a physician before including pomegranate juice into your diet if you have concerns about your prostate health or enlarged prostate. They can provide you with tailored recommendations based on your medical history and particular health conditions. Along with routine medical checks, a holistic approach to prostate health should include dietary changes. 5. Hibiscus tea. Anthocyanins and polyphenols, 2 types of antioxidants found in abundance in hibiscus tea. By neutralizing free radicals, antioxidants help to lower inflammation and oxidative stress. Prostate health and various other health problems are associated with persistent inflammation. There is proof that hibiscus tea has potential health benefits for the heart. Prostate health is contingent upon the preservation of optimal blood flow. According to research, hibiscus may enhance cholesterol levels and reduce blood pressure. The possible diuretic properties of hibiscus tea may also indirectly aid in the promotion of urinary tract health. Prostate health depends on maintaining a healthy urinary system, particularly in cases of BPH. By keeping you hydrated, herbal teas like hibiscus can help you maintain a healthy fluid consumption. For your body to remain at its best, you must drink enough water. You should speak with a healthcare provider if you want to improve prostate health or if you have specific problems with your prostate. Diet, lifestyle, and genetics all affect prostate health. Prostate health is greatly influenced by maintaining good health, scheduling routine medical exams, and adhering to a nutritious and well-balanced diet. Here are 5 beverages that can aid in the reduction of an enlarged prostate. Please forward this instructive movie to someone you think may find it useful. Click the subscribe button for more health-related material. And once again, thanks for watching. Watch you in the upcoming video.